What is the difference between eyelid surgery and brow lift surgery? Hi, I'm Dr. Kristina Tansavatdi and I'm a double board certified facial plastic surgeon. In this video, I'm going to show you 3 cases of my own to demonstrate what the difference is between upper eyelid surgery and what it can accomplish and brow lift surgery. So let's first start out by talking about what does upper eyelid surgery accomplish? Well, upper eyelid surgery will accomplish things by removing this upper eyelid skin. If you have a lot of loose skin that's hanging over your eyelid and drooping, then people will commonly tell me they have heavy upper eyelids where it's sagging or causing a heavy sensation to their eyelids. Brow lift, on the other hand, can address the heaviness of the upper eyelids as well as the brow position. As we age, those brows descend, and there's some other term that I want to talk to you about, and that's lateral hooding. What does that mean? The outside part of your eyelid can start to hood over like this. Instead of just everything falling out once, the outside falls in, and in those cases, that's when you want to look for brow lift surgery to lift that up, because upper eyelid surgery will not take care of that, and the distance between your brow hairs and your upper eyelid crease will determine whether you're a good candidate for brow lift surgery versus eyelid surgery alone. So let's start off by showing you our first case, my first case, and on this patient, I will show you that the distance between her brow hairs and her upper eyelid crease here has changed between the before and after. You see that distance has gone down? So if there's not enough eyelid skin between the crease and the brow hairs, what you're going to have is the brows are going to sit right over the eyelids, and that's going to look like you're actually even more tired after eyelid surgery. So that's a no-no. But in this case, she did have enough space between the upper eyelid crease and the brow hairs, so she was a great candidate for this. And on the side views, you'll see that she had some brow skin overlying, but it was not enough to hood over her eyelids completely. You'll see in the next case where it was hooding, and that's why I did brow lift surgery on that case. So in this case, her eyes are more open. The incision that I used, so you can see on this other side view, this is the incision I used to take out eyelid skin, and that opened up her eyes. You can see on the after picture, and that was all she needed in that case. So this is upper eyelid surgery alone. Let's go on to the next case. So this next case is a good demonstration of where brow lift really comes in handy in these cases. This distance between the upper eyelid and the brow is quite small. And in that case, if I were to do eyelid surgery, it would actually cause the brows to look more heavy and the eyes to look more heavy. So what I did here was a pretracheal brow lift, and you could see a little bit of the incision here in the hairline. That was used so that I could lower her hairline because she felt like she had a very tall or large forehead, and so I lowered the hairline there. And so in addition, you can see after the surgery, her eyes are more open and that crease is more crisp. You can actually see the upper eyelid crease more visibly in the after photo, and that's because we lifted the brow and took care of the hooding. If you look at this photo from the side, you can see this is the hooding. I'm going to let me draw that out where the hooding is, and now that hooding is gone. Same thing, this is really the one that's more visible, where you can see the hooding on the side, this distance here, and that's been opened by the brow lift surgery. All right, let's go on to our last case. Now this is when upper eyelid surgery and brow lift combined can sometimes is sometimes needed in cases. And that's because she both had very little distance between the brow and the upper eyelid, but she also had loose skin in this upper eyelid area. So doing a brow lift alone, and that's a good way to test. I'll show you. If I lift my brow, I'm able to take off a lot of the loose skin over my eyelids. So perhaps a brow lift might be all I need. But if we lift the brow and you still feel that there's this loose bit of skin right above the eyelid, then that's when upper eyelid should be combined with the brow lift surgery. So in this case, I did brow lift to lift the brows, and so you can see this distance has been increased after her surgery compared to before, and her upper eyelid crease is also crisp in that case and more open as well. So there you have it. When I am choosing between brow lift surgery and upper eyelid surgery, we look at the distance between the upper eyelid crease and the brow hairs. We want to have enough distance so we don't drop the brows. And the second reason for doing a brow lift surgery is if there's lateral hooding where that brow is descending and causing this heaviness on the outside of the eye. So those are the two common reasons where I would choose a brow lift, and sometimes combine it also with upper eyelid surgery if there's excess skin there too as well. Thank you for tuning in. For more information, please tune in to our our YouTube channel at Facelift Expert. Thank you.